Heartburn and reflux. These are very common problems that people suffer with these days. The estimate is now about 100 million people, it's about 1/3 of the country, suffers from occasional heartburn or reflux, and about 15 million people suffer every day from these digestive issues. I'm Dr. Michael Gaeta of the Gaeta Institute for Holistic Health Education. I want to talk to you a little bit about this very common issue and the dangers of antacid drugs to resolve these issues and the potential of natural health to address this. As my motto has been for a long time, nature first, drugs last is the best approach. So let's look at this. When people have heartburn or acid reflux, we could divide the causes of this into two basic patterns. One is the excess type. This is where they're actually making too much stomach acid. This is fairly unusual, actually. The real main issue is more of a deficiency type, which I'll talk about in a minute. But what's happening here is an imbalance in the autonomic nervous system, or the automatic nervous system that manages most of our body functions without our having to consciously think about it, like heartbeat and breathing and digestion. So in the excess style, there's too much stomach acid, and we call this parasympathetic dominance. The parasympathetic autonomic system is the rest, relax, and digest part of our automatic nervous system. And in this case, we are parasympathetic dominant, making too much stomach acid. Now, how would you know that it's that type? Well, in this type of case, the person feels better after they eat, and they feel worse on an empty stomach. For example, I had a patient come in not too long ago with this type of acid reflux and heartburn, and he learned to put a bowl of crackers on his nightstand, because it would wake him up in the middle of the night, because he hadn't eaten. Acid was building up, and he needed to eat something to neutralize or soak up that stomach acid, and he had learned to keep that bowl of crackers there. So better after eating, worse on an empty stomach, worse at night in bed, where it may wake you up even. Now, the solution here is to strengthen the parasympathetic nervous system, or strengthen the sympathetic to balance out that hyperactive or predominantly active parasympathetic. And we can use, with either type of heartburn or reflux, there are certain herbs like chamomile and deglycerized licorice and meadowsweet. These are some herbs that can really help to relax things and calm things down. Now, the second type of heartburn or reflux, which is much more common, is the deficiency type. Now, in this case, this is typically sympathetic dominant. Now, this is the fight, flight, or freeze part of our nervous system that gets activated with stress. And most people are in a state of chronic stress. They're sympathetic dominant. Then the parasympathetic, the digestion is impaired. And this is the most common type of reflux. And here, you feel worse after you eat and better on an empty stomach. It's the opposite. And the reason for this is because the person is in a chronic stress state, their digestion is basically shut down most of the time, and they're not digesting anything because they're in a sympathetic dominant state. And in this case, the person needs to relax. So practice meditation, yoga, journaling, earthing, barefoot in the grass, 20, 30 minutes, a few times a week. Things that calm the nervous system are very, very useful. Herbs like kava, for example, can be useful. And we need to calm the nervous system, but also we need to add extra acid, because in this case the cause is rotting food in the stomach from poor digestive function. So what we need to do is boost digestion in the stomach. So we can use things like apple cider vinegar to add acidity to a stomach. And this can be a tablespoon at least once a day, or even once per meal, to increase digestion right away. And sometimes digestive enzymes and stomach acidifiers can help as well on the supplement side. But it is always best to consult a natural health professional before you begin a supplement program to make sure you've got the right quality products and the right products that are specific for your situation and that play well with other supplements or medications you might be taking. So in this type, we need to add more acidity to the stomach and calm the nervous system. And you'll know because you'll take some apple cider vinegar when you have that heartburn and you feel better. And that's because you're starting to digest that food better. So in this case, with heartburn and reflux, we have to seek a natural solution because the antacid drugs are incredibly, literally devastating. We have dozens of diseases directly caused by taking, Nexium or Zantac or Prilosec or something like this that is an antacid. And this is a big problem because we need acidity in the stomach to prevent infection because pathogens, possibly disease-causing organisms, love an alkaline environment and hate an acidic environment. And the healthy flora in our body love and create acidity, and they don't do well in an alkaline environment. For example, our stomach pH is very low. When you eat, the stomach pH should be between 1 and 3. That's pretty low if neutral is at 7. Lots of acid. And we need that in part as a barrier to infection. So when you take an antacid, you set yourself up for gut infections. In the stomach or in the intestines or in the colon, small intestine or colon, you're going to be more likely to develop a gut infection. You're also at a greater risk for anemia because we absorb iron in the stomach. Greater risk for osteoporosis or osteopenia because we absorb calcium in the stomach. Also, you're more likely to develop memory loss and dementia because of the lack of acidity impairing B12 absorption. You develop B12 deficiency issues, which can be very serious. And so no one should be taking an antacid, even according to the current guidelines, for more than 2 to 8 weeks at most. Really should be not more than 2 weeks, and never, ever, ever more than 8 weeks. Now, in my 30 years of practice, I've seen patients come in who have been taking Zantac or Nexium, for example, for 20 years. And they come in with a whole host of health problems, which very likely were caused by that long-term antacid. So, if you or someone you know, or if you're a practitioner and you have a patient who is taking antacids regularly, this becomes I put it to the top of the list of priorities. We have to make those antacids unnecessary, provide a real root cause resolution to that problem, and make those antacids unnecessary. Then they can stop taking them safely without having massive symptoms. So whether you have the excess type or deficiency type, it's very important that you sort this out. And if you're taking an antacid, because we don't want to have heartburn or reflux long term either, that can damage the esophagus and cause other issues in the esophagus later on potentially. So these are the important things to keep in mind. If you want to learn more about this and other subjects, please come to michaelgaeta.com. That's the website for the Gaeta Institute for Holistic Health Education. Lots of articles and free resources, practitioner trainings, and more. So thanks for listening, and improve that digestion. One other thing I just remembered, want to add to that, is ginger tea. Ginger tea can help actually with either style, excess or deficiency style of heartburn. Didn't want to forget that. So having a cup of ginger tea, how do you do that? Just get a tea bag with ginger, or you can get a fresh ginger root and cut 5 slices. 5 slices, about that thick, about a $1/2 thick, about a 1/4 inch or so. 5 slices simmered for 5 minutes. You let it cool and drink your ginger tea. That can be helpful with really any digestive issue that you can think of. Ginger is really a universal digestive remedy in addition to the chamomile, metasweet, and deglycerized licorice that I mentioned before. So thanks for listening, and keep in touch at michaelgaeta.com. Stay safe and stay well. Bye-bye.